This is a brief video on function of the sacroiliac joint, and this joint has a very small amount of rotation in terms of glide and in terms of rotation. It is an important movement, and in the upright posture the sacrum tends to move in forward bending, which draws the posterior ligaments, which then draw the ilia, compressing the joint and making it stable. And the lumbar spine, of course, extends whenever the sacrum goes into forward bending. In line supine, the opposite of that happens, and so the lumbar curve tends to flatten when the client lays supine, and the sacrum tends to go into backward bending, so the top of it, the base, moves posteriorly, apex moves anteriorly. Of course, in females, it's designed to have an ability to have an increased motion coupled with the increased motion in the pubic joint to allow the fetus to descend from the pelvic inlet and down into the pelvic outlet. It is a force transmission function. The upper body weight comes down primarily through the vertebral body of L5 onto the sacrum, and that force is spread down into the ilia and down into the lower extremities. But also the reverse of that is true. The force of heel strike travels up the body and through the SI joint. So it is also a shock absorber. It attenuates the shock, and it also is a force transducer. It changes the direction of force transmission. Designed to be very strong. If it was a delicate structure, well, every time we'd walk or sit down, then it would be painful. But instead, it's a very, very strong structure designed just for a small movement. And so dysfunction would be an alteration in those properties, which could be a weakening of ligament and muscle, of course. And it also could be, that would induce a gain of motion. So hypermobility, of course, is a dysfunction, and as is a decrease in motion. So the function is pretty straightforward, and that's covered in the workbook. And we can't ignore the function of the pelvis as a whole, which is to have a stable foundation for muscle function, those large muscles that originate or insert on that bony structure. And we will stop here. Thank you very much.